www.healthcmi.com. Acupuncture continuing education online today. COVID-19 deaths plummet with Chinese herbal medicine. And before we get into this article that was published at healthcmi.com, if you click on news and look for the article COVID-19 deaths plummet with Chinese herbal medicine, I do want to mention that one of the herbs, actually an entire herbal formula, Lianhua Qingwen, is already in phase 3 FDA clinical trials. That is for influenza, which is a separate virus than the coronavirus, which is another type of virus. So that's also very interesting. But there are recent studies showing that Lianhua Qingwen does prevent viral replication of coronavirus and helps also treat the symptoms of it, like sore throat, headache, lung infection, helps reverse the severe infection and preventing the disease from progressing to more serious stages. So that's very interesting. But let's look at this piece of research and what it says. So it reads, Chinese herbal medicine reduces COVID-19 mortality rates, finds a retrospective study conducted at Wuhan No. 1 Hospital. The hospital is one of the largest centers specifically designed to treat patients with severe coronavirus disease 2019, using an integrated traditional Chinese medicine and biomedicine protocol. So, since its outbreak in December 2019, China has supported an integrated approach to treating COVID-19 due to its high mortality rate, combined with the lack of an effective vaccine or antiviral treatment. Now, we see the vaccines emerging only now. There still will be people, even with widespread distribution of the vaccine, getting things like influenza and coronavirus and different strains throughout the years anyway, so this is highly relevant research for now and the future. Chinese herbal medicine is promoted due to, quote, its multi-component and multi-target characteristics. The results of the study support the use of Chinese herbal medicine in combination with biomedical treatment, finding that it significantly reduces the risk of death due to COVID-19. And then it gives all the details. So again, if you go to healthcmi.com and click on news, this article really goes into a lot of depth of this study. So it was a total of 662 patients in this investigation. 484 received traditional Chinese medicine, and then 178 of which acted as non-Chinese medicine controls. They used oxygen therapy, antiviral treatments, antibiotics, everybody, right? But some people also received herbal medicine, and what happened is that people who received herbal medicine did a lot better. Let's see. The mortality figures, when we look at it, people getting Chinese medicine had a 3.1% mortality rate, so 3.1% of the people died. Without Chinese medicine, 31.5%. Again, this is taking into moderate to very severe cases of COVID. So this is hospital medicine for people who've really been hit hard. This is not for asymptomatic people or people with a light case of it. Those happen as well. Again, if the people are really in danger, of those people, when they get the herbal formula listed here, if you add Chinese medicine into the standard hospital protocol, 3.1% death rate. Without it, 31.5% of these severe cases. So big difference. And the herbs, no big surprise to licensed acupuncturists. Fuling, Huangqi, Huoshan, Kuxing Ren, Baizhu Bancha, Ganqiao, Hopo Mahuang Guizhe, Huangqin Sharen, Jiegang, Peilan, and Dangshen. No big surprises there. It was a decoction form. Those have antiviral properties. Those have what we call anti-damp properties. So what does that mean? In other words, the phlegm, the sputum, it cuts through the phlegm. It prevents it from building up in the lungs, in the sinus cavity. It also prevents people from exuding sputum bolts and becoming contagious for other people. So a lot of advantages to helping the body stop producing this excess onslaught of phlegm. There's a great detail involved in this study. Let's see what they conclude. I'll quote them. This retrospective cohort study is the first to reveal that the use of Chinese herbal medicine in patients with severe and critical COVID-19 can reduce mortality. Thus, TCM may also be an option in the treatment of patients with severe or critical COVID-19, in addition to antiviral or supportive therapies. So kind of interesting. Again, all the people in the study, and I didn't say moderate before, apparently there were no moderate cases here. It is simply for severe and critical cases of COVID-19, looking at those patients. So really interesting study. The other ones we've reviewed so far included a broad spectrum of people who were lightly affected to severely affected. Here, they're only taking the very worst patients and just adding a little bit of herbal medicine into the treatment protocol. So really interesting stuff. Go to healthcmi.com, look for the article entitled COVID-19 Deaths Plummet with Chinese Herbal Medicine. I think you will really enjoy learning about this very hopeful, very promising treatment and the research supporting it. I'm Adam White, licensed acupuncturist. Thank you for listening. www.healthcmi.com